All right, excellent. So we're gonna, the heavy part is prior to the recording. So we're gonna go through like what it's really being trauma informed and how do we apply all of those things that now we know. And again, like thank you, Liz, for mentioning the ACE study. Again, it's been a long time since they did it. It was a sample of mostly white, middle class, California group. And even with all of that, they found like how remarkable those adverse childhood experiences were for like their life and long-term effects. So again, like if we couple that with the social determinants of health and what we know, and again, Arlington has really good data and they're like great groups working on it and like really teasing out how, depending on the neighborhood that you live in Arlington, here locally, you may have a life expectancy that is shorter than other zip codes. You may have more chances to get asthma, to suffer from asthma. So if we get the ACEs study and the social determinants of health, we really understand that our, like many of the clients that we work with are responding to things that have been happening to them. They're not they're having very normal responses to very abnormal and equal and inferred things that have happened. So what do we do with all of that? Next slide, please. So things that are not accounted for, and like my personal piece here, why many of us might be drawn to the work that we do. It's that what is not accounted for is that we have this resiliency component, we have what is called protective factors, and we have the ability for our brains, as our brains change with trauma. There is, again, lots of good studies about that neuroplasticity, the ability to grow and create new connections and learn and heal and still change. So it works both ways, right? It works as our brain changing because of something that happened to us. What those meaningful interactions that we have with our clients, young, like children or not, are meaningful and can be those repairing factors and healing. So the image that I have is what you see there, as it's called, it's kintsugi or kintsukuroi, and it's a Japanese art that when something breaks, they actually repair it with gold and see that it's even more beautiful. So they're not trying to hide the pieces that were broken. It's healed with care, and it can create a more beautiful piece. And in many ways, what we want to inspire our clients is that they know that it was things that happened to them. It are things that were probably not fair. It was things that were, crimes. And we have that ability to, as helpers, and the tools that we have is help them heal and get those new connections in the brain. Get that. What we know, protective factors are huge for those are like buffers. Think about like really those shields. So protective factors are supportive relationships, those community services available, opportunities to succeed, opportunities to like learn something new. What it doesn't account on the ACEs is the individual differences. Not everyone who experiences trauma will have a poor outcome. And someone that may have not had 4 or more ACEs may actually, like that may not protect them from, present with like long adverse or, long-term effects. But it does tells us about the greater risk. What are some really things here to like remember? Because it's, we can get like very, experience some sense of hopelessness if we just see that, oh, this is all horrible, nothing is going to change, or like it's just what can we do really, like when someone is coming to me and it's already bringing all of that I may not even know, what do I do? Very important to remember the presence of one caring adult, only one. It takes only one adult in a person's life, in a child's life, to shield that individual and help them buffer that stress from their lives. It doesn't have to be the parent. It doesn't have to be the parent. So think about your role in what you do when you're interacting with a child, with your clients. Think about, our volunteers that come and, help us with like different, pieces. Think about our schools and the importance of that teacher or that teacher aide or that liaison that it's coming and can make the impact in that child. It has tremendous ability to shield and buffer stress. Resilience, it takes really that combination of the protective factors, what we can surround our families and our clients around, and those individual, factors. We all come in different packages and we all respond differently. So again, biology, we saw in that video about epigenetics and, like how also like we can alter that. And the neuroplasticity, very cool, very, very, very cool understanding that, like in the past we thought that, after babies, that was like the end of it, or the 4-year-old, and then you cannot learn anything. The brain has the ability to create new connections, and that's where like we really, again, play a role. So working on safety, making that different, those connections, that personal investment is really what make the key many times. And understanding that our brains, as they were altered at some point, they can still grow and heal and repair and, become more beautiful. So next. So there is another link in the next slide that has a PDF. I can send it to you, Trina. So like you can, when you're sending the slides, you're also sending a couple of other documents that, we can add. It's really a wonderful document. It's about 10 pages. It's a PDF, and it really talks about like what to do in our programs, in our agencies to become trauma informed. Very helpful, and it kind of addresses some of these things about, like understanding the impact of trauma. It's across. It's not like one person, it's not our client, it's not me, our colleagues, our partners, our families, our clients. We all come with our own histories of big T's and small T's, like big traumas and small traumas. And sometimes those small T's can be, a lot more pervasive. Recognize the signs and symptoms so we can understand and we can address them. So realize, understand that, yes, this is what's happening. Recognize what, like those fear responses that we talked about, the previous F's, right? Now we're talking about the R's, the previous F's. Like, is this something like it's a freeze or flight or fight? And how we can adjust our response. So if someone is responding to us with a big F of fight, we don't have to get there. That is our ability and our tool to really support that person into, do not match them with the other fight. Understand that that is a response and that we have the ability to, present a different alternative. It also, again, it comes with all our policies and how as agencies and programs we can make our spaces, respond and understand that it's so pervasive that, like the assumption is that when you have someone walking to you, that person has a history of trauma. So what do we do to make our spaces, our programs, our work, trauma response, trauma informed? And then, again, resist that, re-traumatization. So, and I think like there is a lot of good work that it has happened. Like, how do we make sure that not like 6 people are asking the same question, or we are responding with the same, matching that F, fight, flight to that person to the point that, we're not moving, we're all stuck. One thing that I forgot to mention is that, again, like because the world is altered, we might not see it might be a trigger. We don't know. It's very hard to understand what can be a trigger. Sometimes our clients can tell us, and sometimes they may not even know what could become a trigger. So it's something as simple, like as, maybe Kathy had a comment before about, like maybe sitting down and talking about your goals. That is not threatening. I'm just talking here and taking notes. That might not be threatening to us, but it might be very threatening to them. It might be they fear that if they don't agree with you, they may lose their bet, right? Nobody has told them that, but that's what they are responding to. So again, like good reminders, you will have this information. So couple, again, takeaways here: safety and connection. Safety and connection. If nothing else, if we cannot do anything else, the safety and connection is really helping that brain to create those different connections. Next slide, please. Again, part of, that's the PDF. So I'll send that along as well. It's the SAMHSA kind of principles to trauma-informed approach. Many of your programs may already have them in place. Maybe not like as those 6 specific principles, but we can like find things that we're all doing or things that we can do better. There is always opportunity for us to, like group and see, okay, how are we doing with safety? How is our program really responding to safety from a trauma-informed approach? How are we doing with, like transparency and trustworthiness? Is it something that we're communicating to our clients, that there is not any assumptions of like things that we're doing or things that we're not doing that, may not look as, transparent to them? And with our own, workforce. Are we communicating enough, or we're not communicating? Peer support, same thing. So really good opportunities for, again, each particular program and agency to look at these and see like what are some of those areas that like we're doing really well and we can do better. I would also say, and this is, like where the local community and where the groups that are happening right now are very important, because we can have a really strong trauma-informed program, but that person is not going to stay with us forever, and that person lives in a community where, again, they're walking with their trauma everywhere they go. So the piece here about like advocacy and really elevate that and collaborate and really rise that, ability at the systems level is that our communities need to be trauma informed. So we need healthcare systems that understand this. We need judges and the court to understand what is trauma informed. It's not one program. We need our schools. We need like really all of us to be those kind of amplifiers, or how trauma is relevant, trauma is, with us, and how our response is really in our hands to not just do one program that is trauma informed, but it's really our community and how we can all share, that. So when our clients are walking out of our, office and they go and meet with the school teacher, they're also finding that support and that understanding. When they're going to talk to the judge because they have to like get a protective order, they have a judge that understands that maybe their memory is not all coming sequential and that they may need a break, and that there are things that, again, they're, because they're used to be one way doesn't mean that is the best way to exist. Notice that, again, like in the 6 principles, there is like addressing those cultural, historical, gender, racial issues. Very important. We cannot talk about being trauma informed. We cannot talk about being, responsive to it if we're not addressing and understanding that it really like crosses, across everything we do and everything who we are. Questions, thoughts on this? We have 4 minutes, right? Yes? Okay. All right. So not gonna talk much about this other than, again, remember the 4 Fs, like the trauma reactions, and the 4 Rs, trauma-informed responses. So you'll get the slides. These are sort of like those things that are helpful for us when like we have clients and they may present us in crisis. Next. And here, a couple of things that are important for us as helpers and providers. And that will help that, like that regulation and like sort of like kind of like the systems get connected with each other. Ask permission. It might be like simple, but it goes a long way. Can I give you some feedback? Can I sit down with you? Is it okay if I suggest this? Simple, it goes a long way. You're not, again, like with power dynamics, very helpful. State the obvious when you're seeing something, like, I see that you're breathing heavily, or I see that maybe something that I say had an impact on you. It may help them, and it may also help you, like walk through step by step. So state the obvious, not to like, like I see a wall, but again, state the obvious. It may help you also regulate when you have a dysregulated client. And watch for your own triggers and stressors, because again, we are the best tool we have. So if we're not in our best, it may transpire and may not be as effective as we think we are or we want to be. And the best advice that I've got, so I always want to pass it on, when we're like working with our clients, we like try to imagine yourself as a mirror, not a sponge. A sponge, we like grab everything that they're sharing, and they might be sharing very heavy stuff. Maybe they're sharing it for the first time. If we're working really well with established safety and connection, you may be the person that hears something that they may have not shared with anyone else. So as supportive and connected as you want to be, we are a mirror, so we help them see it as opposed to take it all and then the weight is on us. Okay, one more thing and then you'll have everything. So you'll see that, again, there are some more techniques about grounding, like helping the regulate our systems, very helpful, again, for us as when we're trying to regulate ourselves, but also like techniques that we can do with our clients. If they're coming to you, you see them like they're really, really upset, or they might just not, like they're having a hard time concentrating. These are easy things that, again, like you don't have to have like fancy tools. It's like, okay, let's name 5 things that we see right now. It kind of helps you reset our brain. So you'll have that. And one more here. Let me see. Yes. So we talked about how trauma, impacts us. Even if we're trying to be mirrors, not sponges, it may get to us. Secondary trauma, hearing from it, like getting some of those stories can be really hard. We might start feeling like, lots of different things. This could be like a whole different, 1 hour session, 2 hour session on how like we mitigate that compassion fatigue. What we don't always talk about is that vicarious resilience and that satisfaction and compassion satisfaction. And it really has seen as like the most effective tool to mitigate compassion fatigue. Not to invalidate, not to try not to, hear those or be empathetic, but really understand how, like we check ourselves, but also how there is a tremendous learning that we get from working with our clients and working in this field. So we're 1 minute late. Thank you, Trina. Sorry about that, everyone. Any, pending questions or anything? Happy to answer.
Thanks so much, Deanna. Maybe what we can do is folks check out, we can stop recording, and if anyone does want to stay a little bit longer to ask 1 or 2 questions, I have a few more minutes on my end too if you have a couple. Thanks everyone for joining us. Again, we'll share out the slides and the recordings of they'll come in 2 parts for today's training. Deanna, really appreciate your time and sharing some of these concepts and your expertise and experience with our rest of our partners. just yeah, thank you. No other parting words, but thank you and deep gratitude. So take
Thank
care of
you so much.
yourselves. Take care of each other. I'm going to stop
Yes.
recording if folks have questions.
Thank you. Bye.